If you are sick and tired of the symptoms of PCOS and also lack of answers about the root cause of PCOS you may have been getting from your healthcare providers, then this video is what you are probably be looking for. I am going to go into details about the root cause of PCOS, not just what causes the symptoms, and what you can do to start reversing the root cause today. Let's talk about the ugly truth of PCOS. Women really get a creepy deals when it comes to the diagnosis and treatment of PCOS. First of all, it takes the average woman 7 to 11 years before she receives a proper diagnosis of PCOS. And then doctors who very often have gross misconception about PCOS is wind up treating a lot of symptoms with different medication, but they very frequently completely neglect to talk about the root cause and what you can do to reverse that. PCOS, like many medical conditions, is misnamed. It was named back when all we did not hardly know anything about endocrinology or hormones and how they moderate all the physiological behavior of your body. The cysts are not actually the cysts, they are follicles. And the cysts on your ovaries actually have nothing to do with the diagnosis of PCOS. This is a leftover back when we just did not know better. It is still called PCOS, but the cysts are not the cysts, and they are not the cause of your PCOS. They are actually caused by the root cause that I'm going to explain to you in a minute. Probably 1 to 5% of the cause of PCOS is genetics. You inherited the predisposition for that. Probably 1 to 5% of the cause of PCOS is actually your mom's metabolic health and her diet while you were cooking in her uterus before you were even born. So that leaves us with 90 or 95% of the root cause that doctors didn't seem to have a clue about when you go to see your healthcare providers about PCOS. All they want to talk about is drugs, and more drugs. You might wind up getting glucophage, you might wind up getting clomiphene, and so on. You are probably going to end up getting an oral contraceptive or a combined contraceptive therapy. None of this treats the actual root cause of your PCOS. You deserve answers and you deserve a solution to your PCOS. You have suffered long enough, so let's get into this. When your doctor check the lab work like your DHEA level, your total testosterone, your LH or FH level, your prolactin level, and so on, they are actually checking the distal or distant level on the tree. If you think about your PCOS diagnosis and the causes as a tree, the trunk of the tree would actually be the root cause. The small branches and the leaves are the causes of different symptoms, right? So all of the testing they are doing and all of the drug they are giving you are treating the little twigs and leaves. The symptoms, not the root cause. They completely ignore the drugs. So, what is the drug? The drug or the root cause of your PCOS is hyperinsulinemia. You have chronically elevated level of insulin in your blood. When your insulin is chronically elevated, it causes all of your other hormones, including DHEA, total testosterone, your estrogen, your cortisol, it causes them to go into the wrong direction. And that was leads to the symptoms of your PCOS. These symptoms can include irregular or absent period, acne, hair where you don't want it, or hair living where you don't want it, skin discoloration, stress, depression, and many more. The reason that your doctors are not even aware of your hyperinsulinemia is that they don't even know how to check the appropriate lab work that will diagnose it. The two most common labs that can be used for this are C-peptide and a fasting insulin. And if I bet, if you will pull up all of your old lab work on your app or from that your folder where you kept all your labs, you'll notice that these tests have never been checked on you. Thus, that's why your doctors does not know that you are hyperinsulinemia. It's because he or she haven't checked for your hyperinsulinemia. When your insulin level are chronically high, most of your tissue like your muscles and your fat cells, they become what is called insulin resistance. But there are two tissues at least that remain insulin sensitives, and that are your ovaries and your adrenal gland. And that is where the hormones like DHEA, cortisol, estrogen, testosterone, progesterone, that is where they are all modulated. So you have got chronic high level of insulin in your blood, and that's I'm going to tell you what causes that and what you can do to start to reverse it in just a minute. But your muscles and fat cell becomes insulin resistance. So they are trying to cope with this hyperinsulinemia. Your ovaries and adrenal gland are unable to become insulin resistant, so they remain insulin sensitive even in the face of this chronic hyperinsulinemia. So now, the question is, what's causing you to have chronic elevated level of insulin in your blood? It's your diet. There are certain food when you eat them, they spike your insulin very high. There are other food when you eat them, they elevate your insulin a little bit. Maybe many will say an appropriate amount, but then it doesn't go as high. There are other foods that barely elevate your insulin level at all. I have got this graphic up on the screen so you can see this. The thing that elevates your insulin level the most is carbohydrate or a highly refined junk food made of sugar and grains. Those are what cause your insulin level to be chronically very high and to stay high throughout the day. So now, you know the root cause of your PCOS, hyperinsulinemia. And now you also know what causes your insulin level to be chronically high and to be very, very high. It is a carbohydrate overdose syndrome that's coming from the foods that you are currently eating. And that could even be the food that you have been specifically told by your doctors to eat, like whole grain breads, lot of fruits and fruit smoothies, a plant-based diet. All of these things can spike your insulin and keep it elevated all day long. So now let's talk about what you are gonna do to reverse your hyperinsulinemia and therefore start to immediately reverse your symptoms of PCOS. The first step to reversing your PCOS by reversing your hyperinsulinemia is to drastically reduce the amount of carbohydrates you are eating in your diet on daily basis. Now, the first carbohydrate you need to get rid of are the highly processed carbohydrate filled with sugar and ground up grain, okay? So all the junk food that is directly leading to elevated insulin, which is then messing your other hormones, which is then causing all of your PCOS symptoms. So when you reduce and get rid of the junk food, that is going to immediately start to help. And by the junk food, I mean things that are full of sugar and ground up grains, okay? Now, for some people, reducing their total carbohydrate intake to less than 100 total grains a day. Over the next few months, their PCOS symptoms will go completely away. Other people have to reduce their total carbohydrate intake daily to 50 grams. And then a third categories of people has to reduce them even further down to under 20 grams of carbohydrates a day. Now, it took years for you to develop the symptoms of your PCOS. So don't expect your PCOS symptoms to go away in a day or two. Your hyperinsulinemia will start to get better immediately the same day you adopt a low carbohydrate diet. But it will take weeks for your other hormones to get back in their proper ranges. And then it will take weeks or months for the symptoms caused by those inappropriate elevation of these hormones to start to revise and go back to normal. I call this therapeutic carbohydrate reduction, and that's what you should think of this and as a therapeutic intervention. Many people call this type of diet a low carb diet, a ketogenic diet, or carnivore diet. I will drop a lot of videos on this channel about just the type of diet. And as I said earlier, this type of diet is going to start to revise your chronic elevated insulin level immediately, within an hour. Your insulin level will start to return to normal. Your body is not broken, and you are not stuck with PCOS for the rest of your life. You can take charge of this today and start to improve and even revise your PCOS symptom as soon as you are finished with this video. Talk with your doctor before you decide to stop any of these current PCOS medication that you are taking. But what we are going to notice as we go by, after you have adapted a therapeutic carbohydrate, when you have adapted to therapeutic carbohydrate reduction regime in your diet and in your life, is you are not going to need those medication after some point in this therapy. And when that time, you and your doctors can decide together to stop your medication. If you have a friend suffering from PCOS, it might help you and her actually to do this therapeutic carbohydrate reduction together. And also, it will help me to reach more people and help her if you share this video with her. I will see you in my next video. Thank you.